I was more than happy to come over, as I'm convinced that more people should be informed of the advantages of using the patches and how they can improve the quality of your life. You know the saying, there's more to it than meets the eye, which in my case is to be taken literal, as I have a nephrostomy in my right side kidney. I've had this nephrostomy for about 3.5 years already, and I don't know whether to call it providence, but anyway, at the time when the insertion point was very, very painful and was severely scarred, I learned about the patches that Bedal produces. The catheter had to be inserted to drain the kidney, and at the same time was fixated with stitches. Now, in theory, such a catheter has to be replaced every 6 weeks, so it could be 4 or 8. But in my case, sometimes it didn't even last for 2 weeks because the catheter or the catheter had moved and caused too much pain, or there was a kinking in the drainage. You can imagine what the insertion point looked like after a couple of switches. It was all reddish, as you can see on the slide, reddish, swollen, infected, and extremely sensitive, especially after every switch. These stitches also involved that I wasn't very mobile the first couple of days after the switch. Because the skin was so sensitive and I was afraid to move, so I had to stay in bed for a couple of days, or I was feeling nauseous of the sedation. So, in fact, it was a very fortunate coincidence that in 2021, the urologist I was seeing had heard of the drain patches, and he brought me into contact with Fabian at Bedal, Belgium at the time. But the doctors treating me, they still had their doubts, and they suggested at first a combination of the two, and the stitches and a patch. But it felt good. It felt more secure with the patch, and the risk of the catheter being moved or pulled out was minimized. So what can also happen at night, I have this night drainage bag hooked onto the bed. What also can happen is that it accidentally falls down on the floor when you toss or turn in your sleep, and then you feel the pull as well on the patch. I felt really so secure with the patches that I did not go for the larger format, which is this one, but I chose to use the smaller format. This one. Why? Because I was a bit afraid that maybe I would get a rash or an irritation underneath the patch, but I had neither. So the result was surprising. It went beyond my expectations. No more sedation necessary, no more stitching necessary, which was very important to me. No more feeling sore for a couple of days after the switch and be more mobile. No more kinking of the catheter. That didn't happen anymore when I had the patch. So to me, this is the ultimate proof that the patches should be given priority than the stitching. So the patches made my life more flexible and provided me with more free time. Now the nurses only come around maybe once a week to change the bandages or to change the patch. I can even go on holiday or take a break for a couple of days, even come to a convention like this one now, without having to provide someone who can give me the medical care I need. Another advantage is that I have to spend less time in hospital because the replacement of the catheter now involves only maybe half an hour at the most, instead of having to stay in a hospital bed for about half a day and to be taken to the operation room for doing the stitches and all that, which is not only time-saving, but also important from a financial point of view, I think, depending on the hospital insurances in the different countries. Now, I don't know whether you can fully imagine what it means to me mentally and physically, these patches, but I feel so good now that the scar slowly healed and was less painful. I felt reassured that the catheter would stay well fixed in the patch, and this encouraged me to do sports again and resume part of the life that I led before. That's why it's still so hard for me to understand why some doctors are so reluctant to change to the patch system, but want to stick to the traditional system of this stitching. Whereas from a patient's point of view, as was already pointed out, I think the choice should be obvious and the patient's comfort should get priority. So now I can go to bed and sleep on either side. I can toss and turn in my sleep and I can end up on the patch without waking up. So that's a very good feeling. This wasn't the case with the drain patches, and certainly not with the stitches. Then I had to make sure to keep immobilized in bed. I had lots of pillows supporting me, making sure I didn't move and could sleep only in one position, which isn't the case now. Now I can move in my sleep, sleep on both sides without waking up. And I don't think I have to convince any of you, if you have a good night's sleep and an uninterrupted sleep, how different you feel the next day. For all of the good reasons I've mentioned here, I would like to conclude that more doctors, more patients need to be convinced of the advantages of the patch system, which means that you all have an important mission to fulfill. A mission to make sure that the comfort and the well-being of so many patients should get priority. Then the whole purpose of my being here is achieved.